Mrs. Graham. I'm Jen. I'll be your nurse today. Nice to meet you. Today we're going to perform a neurological exam. So I want you to know I've washed my hands prior to coming into the room. And I want to explain to you what a neurological exam consists of. We're going to test your alertness to person, place, and time, as well as your consciousness, and 12 cranial nerves, which is a series of physical exams, along with some questions. So the first thing we're going to do is check your armband here. Can I have your name?
It's Jenna Graham.
And your date of birth?
12/5/84.
Good. And part of the series of questions is, can you tell me what time it is?
It is about 3 o'clock.
Good. And can you tell me where you are?
St. Clair Hospital.
Perfect. Okay, so we're going to start with cranial nerve 1, which is the olfactory nerve, which is also known as how you smell. So the first thing we're going to do is I'm going to give you something to smell. You'll describe to me what it is.
Okay.
Smell that for me.
Smells like blueberry.
Good. The blueberry marker. And then if I can have you take your finger and close one nostril and breathe in. Good. And the other side. Perfect. Any problems? Good. So each nostril is patent. Cranial nerve 2 is your optic nerve, also known as your sight nerve. And for your vision check, I'm going to give you a book, and I'm going to have you read 2 different lines from the book for me.
Okay. This is a big book.
It is a big book.
Okay.
If you can read this line for me.
The Song of Robin, the Majesty of Snow-Covered Mountain Peaks.
Good. And if you could read the smaller line beneath that.
This one?
Sure.
He will replace your clouds of despair with the brilliant penetrating light of his everlasting love.
Great. Thank you. Okay. And then I'm going to have you cover one eye, and I'm going to cover the mirror eye, and I'm going to wiggle my fingers, and this is going to check for your peripheral vision, and then tell me when you see my fingers wiggling.
I see it.
Good. Other eye.
I see it.
Perfect. Okay. Now I'm going to use a light to check for your red reflex. So if you could look at me. Good. Perfect. Any questions at this point? Okay, good. Cranial nerve 3, 4, and 6 will be assessed now, which is your ocular, motor, trochlear, and abducens. Okay. I'm going to use the flashlight again, and we're going to check for perla to make sure you have brisk constriction, both directly and indirectly in both eyes. And if you could, here, good, good. Okay, if you could look straight ahead and follow my finger. Perfect. The next nerve we're going to check is cranial nerve 5, which is your trigeminal nerve, also known as your facial muscles. So if I could have you place your hands on your lap straight, and if you could tighten your jaw for me. Good. And press down. Good. Now what I'm going to do is test a sharp object and a soft object on a couple different places on your face. So we're going to use a tissue and a pointer, okay? So sharp, soft.
Okay.
Ready? Close your eyes and indicate when you feel this.
Sharp, soft, sharp, sharp, soft, soft.
Good, thank you. Cranial nerve 7 is the facial nerve, and I'm going to have you at this time raise your eyebrows for me. Good. Close your eyes tightly. If you could smile, and while you're smiling, I'm just going to check your teeth. You have beautiful teeth.
Thank you.
You're welcome. Can you frown for me, please? Good. Blow your cheeks out. Good. And then the last one is taste, but we're not going to do taste today.
Okay.
Cranial nerve 8 is your vestibular auditory nerve, and this is going to be the whisper test. So I need you to close your ear, and I'm going to whisper a 2-syllable word, and I need you to repeat it back to me. Okay?
Here?
Sure.
Okay.
Baseball.
Baseball.
Ice cream.
Ice cream.
Good job. Cranial nerve 9 and 10 we're going to assess together, which is your glossopharyngeal nerve and your vagus nerve. So one is for swallowing and one is for gag reflex. I'm not going to do the gag reflex on you today, okay? I'm I'm gonna get the flashlight. I just wanna look in the back of your throat. If you could stick your tongue out and say ah. Good, again. Good, so I see that vibrating, so that's good. Cranial nerve 11 is your accessory nerve. So by moving your head and shoulders, I need you to push down for me. Good, and then shrug your shoulders twice. Perfect. Cranial nerve 12 is your hypoglossal nerve, which is connected to your tongue, your speech, and your swallowing. If you could stick your tongue out for me and go up and go down and side to side. Good, so we're just testing for steadiness of your tongue. So that concludes your cranial nerves. Now the second portion of this assessment consists of the neurological exam, which is going to have to consist of you standing up, and we're going to do something called tandem walking. So if I could have you stand, please. And I want you to walk heel to toe, just a few steps, and then turn around and come back for me, please. Good. Perfect. And then, still standing, we're going to do the Romberg test for balance. So if I could have you put your arms straight out in front of you and turn your palms upward, close your eyes, and we're going to test for steadiness while your eyes are closed. Make sure that you're steady. Great, you have great equilibrium, which means there's no problem with your cerebellum. Thank you. So you can have a seat. And now we're going to test your fine motor skills and your gross motor skills.
Okay.
So your fine motor skill test, the first thing I want you to do is take your thumb and touch each finger to your thumb back and forth as fast as you can. Perfect. Now if you could place your hands on your thighs and flip them back and forth, up and down in a rapid alternating movement, please, similar to this. Perfect. Close your eyes and extend your arms out to your side. And as fast as you can, please touch your pointer finger to your the tip of your nose. Good. Now if you can place your finger on your nose by opening your eyes and touch my finger. Perfect. Now move your finger and follow it with me. So take your finger to your nose and touch my finger as I move. This is going to show coordination. Perfect. Thank you. And then similar to what we just did with your upper extremities, we're going to do with your lower extremities. So if you could take your heel and slide it down from the knee down your shin on each leg. Perfect. Now we're going to test for good sensation. So I'm going to get the pointer again and the tissue. And I want you to close your eyes, and all over your upper extremities and your lower extremities, I need you to tell me when you feel soft or sharp.
Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp.
Good. Very good. And we're almost done. The vibratory sense, I'm going to use an instrument, and I want you to tell me when you feel this instrument vibrate, okay? And we're just going to do it to your thumb and your foot, okay?
Feel it?
Good.
I feel it.
Perfect. Okay, and then for deep tendon reflex, I'm going to check your reflexes. There's a couple different places we can do this. I'm just going to go with your knee, okay? And a knee jerk is a 2+, which indicates a good knee jerk. So, see here? Good. Good. And then lastly is the Felkins test. And the Felkins test, I want you to place your hands together, kind of like in a praying position, but downwards for me. Good. Any discomfort? Perfect. Well, thank you very much, and that concludes our assessment. Do you have any questions?
No.
Great, thank you.
Thank you.